Good evening, Holliston. Welcome to the Select Board's meeting for Monday, December 7th, 2020. Thank you for joining us this evening. We have an agenda that's going to undergo a little bit of maneuvering here. Our agenda includes, as item number one, a continuation of the tax classification hearing that we started last week. The classification hearing, for reasons of scheduling, will be moved to 7:30 this evening when we will give an update on that item. We'll move into our agenda item next regarding coronavirus community updates with Chief Cassidy. And this evening we will also be entering into executive session. We'll time that out as we finish up the remainder of our agenda and let folks know what's going on. But we will flow now to Chief Cassidy for the weekly coronavirus community update, followed by the CARES Act programmatic update. Good evening, Chief.
Good evening, Mr. Chairman.
Are you correctly positioned?
I believe I'm correctly positioned.
Are you crashing anybody's photo op?
I hope that I'm not in anyone's line of
Perfect.
I look very lonely on this side of the pulpit.
There you go, Tina.
Well, thank you for having me.
Always in the Chief's shadow, aren't we?
That's right, that's right. It's the best place to be.
It is kind of like Groundhog Day, isn't it?
It is.
So currently we have 258 cases since we first received notification back in the spring of our first case. Of those 258, 206 have recovered. We have 6 COVID-related deaths and 46 active cases. Those 46 active cases are at 37 individual addresses, which represent 5 clusters in single-family homes, 1 cluster in a multi-family dwelling, 1 single case at an elderly housing complex, 4 single cases at multifamily dwelling, and the remainder are all 26 single cases at single-family homes. I do want to draw attention to the reality that since I saw you last, we are now announcing that we have had 6 COVID-related deaths. That's up significantly from where we have been for many, many months. And I don't want people to think that those 4 additional COVID-related deaths happened last week. Those were a data correction for COVID-related deaths that were reported to public health back in April, May, and September. But I only became aware of them last week. So as soon as I became aware of them, I published them with an asterisk indicating that those were old cases that had been taken off of the active rolls in previous months. In terms of our messaging, we are continuing to see about 1,200 to 1,500 engagements with our social media platform. So we continue to get the message out there with all of the various mitigation steps that we're...
This is that public service announcement strategy?
Right, through the Facebook and the Twitter and the Blackboard messaging. And we're wanting to make sure that we don't do message overload with folks. So when I found out last week that the Commissioner of Public Health from the Commonwealth was about to send out an Everbridge notice, I scrapped our message that was supposed to go out because I didn't want people to start ignoring when the phone rings or when they get a message. So we will regroup and get our Blackboard message out shortly. Our positivity rate increased last week. We were up to 4.16 when the data was published, the weekly data was published on December 3rd. That was up from 3.52 the previous week. But as we dug a little bit deeper into the data, we realized that part of that bump, because our average number of cases per 100,000 population had remained the same from 1127 to 12.3, and it was that there had been fewer tests. So we're anxiously awaiting the test results, the weekly reports coming out this Thursday, looking to see what the impact of post-Thanksgiving is. And then it will be another week before we see the dip that the state is seeing related to last Saturday's snowstorm. So with the snowstorm that hit the Commonwealth, there were fewer tests administered on Saturday. So as they track, and those numbers are put out sooner, total number of tests administered in the Commonwealth on a daily basis, that dip in number of tests administered that could include Holliston residents won't hit our data for Partially this Thursday, but more likely the following Thursday. Before I get to the programmatic update, I would like to express my thanks for everyone that was involved in making the special town meeting a success. Thanks to the public schools for hosting us. Thanks to the technology department for helping to set up and making sure that everything was ready to go. Thanks to facilities for help with setup. Thanks to HCAT for their live coverage, Holliston Reporter for their post coverage. Thank you to your board for lowering the quorum. That was very, very helpful. Thank you to the town administrator for publishing a very clear and succinct warrant with very good explanations. Thanks to the town clerk and her staff for the efficient check-in, taking minutes. Thanks to the moderator for keeping debate to a minimum, but yet allowing people to be heard and their questions to be answered. Thanks to members of my department for the role of health and safety monitors, and most importantly, thank you to the 82 voters who showed up so that we could get the business done safely and efficiently. We will be monitoring any new cases that come in the next couple weeks, comparing those addresses against all those who attended special town meeting. I do have the list from the town clerk of everyone that attended, so that as each new case comes in the next 2 weeks, I will compare those addresses and determine if we need to do any additional notification or contact tracing. And with that, I will pause before the programmatic update.
Thank you, Chief. We'll start with any questions from Mr. Sparrow.
A couple things. So the first one, could you tell us what you mean with social media by engagement? What does that indicate?
So the different platforms have different ways of monitoring. On Facebook, it's called Insights. And so impressions would be if somebody saw our post and viewed it, that would be considered an engagement. That's different from somebody who
It's not a click, per se, going to our website kind of thing.
No, and it's not necessarily a like or a share. Those are tracked separately, and I do see those. But just in terms of pure eyes on our content, it's hovering around 12 to 1,500 on the Facebook platform, which is good because I believe that our likes is only at 1,600.
Okay.
So most people have it so that they're seeing, and then as we continue to push it out through other platforms as well, the more ways we can get the message out, the best.
Got it. I have another question and then a comment. So the other question I have is so with respect to the 6 fatalities, I guess, how do we determine if someone has a COVID fatality? Is it they had COVID and passed away, or COVID was the cause of death? Like, how does that work?
Sure. So that's an excellent question, and I did see a little bit of curiosity about that same topic on social media once our numbers were published, going from 2 to 6. So from a public health standpoint, if at the time of death the individual had the coronavirus in their body, then they have been coding those as COVID-related deaths.
Okay.
Some of them, there's a clear linkage,
Yep.
and you even saw this in a few of the obituaries, where the family would indicate the person passed following a short battle with COVID. Others, and this is why some of these had not been on my radar, we hadn't seen anything in the obituaries, and it was deeply embedded in some public health reports that I didn't have access to.
Okay.
And so exactly whether there was causation or correlation, I don't know all of those details.
Okay.
But I can assure you that nobody wants to code something as a COVID-related death unless there is some reasonable index of suspicion to code it as such.
Certainly.
No one's trying to inflate these numbers. They're
Absolutely.
trying to be as...
Absolutely. I just kind of wanted to understand how the metrics were calculated.
Sure.
So the only other thing is just a comment. Well, actually, 2 comments. First of all, thank you so much again for all the work that you did for getting us ready for town meeting. We really appreciate everything that you did, and I know it was a lot of effort in many respects. So I just wanted to say personally, thank you so much, and I'm sure the rest of my board shares that sentiment. The other thing I just wanted to bring up too was I read in the New York Times the other day, and I really like this, and I just kind of wanted to bring up. Have you heard about the Swiss cheese model of combating COVID? Basically, the idea is that Swiss cheese has holes. So there's lots of individual slices that have holes in them, but the goal is the more slices you have, the more holes you can plug up. So making sure you wear a mask, making sure you're socially distancing, trying not to be in large groups, making sure that you're washing your hands, not touching your face. And so, doing one of these things certainly has risks, but doing all of these things, you start to mitigate some of that risk. And I just thought it was a very it's sort of an important way to look at this, that certainly individually one of these things is impactful, but doing all of these things and working together with public health and things like that really can have an impact in controlling the virus. And you see that in places like in North Dakota, where they're completely ignoring everything and they're having a catastrophe. And we just hope that people are still engaging with it and still making sure that even with the holidays approaching, that we're still thinking about these things and making sure, hey, this is hard, but we got to get through this. So I just thought it was a nice sort of way of looking at these different things that we're doing as all sort of working together to help us combat the virus.
That's a really important point. I know the governor was quite direct today during his remarks publicly over his frustration that some folks opted not to follow a lot of the guidance that had been provided prior to Thanksgiving, and he's really concerned about what's going to happen with the holidays later this month. And he's under a lot of pressure right now. There are a lot of people who are urging him to have more areas and sectors of our economy and our society shut down, and he's resisting that at this time, but I'm not sure how long that's going to be able to be effective.
The numbers might push him in another direction,
right?
Whether we want to be or not.
Correct.
So that's all I have. Thank you. Thank you very much.
Ms. Hahn?
2 questions. The Everbridge notification system for the state?
Yes.
Is that an 866 number? Because what I have experienced myself and heard from others is you don't know who's calling you. So what are the first 3 digits that are going to pop up on your phone so that you know to pick up the phone to hear the message?
They're using a bank of phones, so there are several different prefixes, which is different from what we have with our Blackboard system, where we can set the specific number that will show up on caller ID, so that when we're sending a message about water quality, we use the water department number. When we're sending a notice about an upcoming meeting, it might be the town clerk's number that shows, so that when people look at the caller ID, they know it's the town of Holliston.
So there's no hack for this one?
I have heard a lot of people who have let it go to voicemail because they thought or it's showing up on their as spam. And that's a problem.
Okay. Then the second thing that I wanted to ask you about, I understand the circumstances that have led to the jump from 2 to 6 deaths. However, we do know, and we've been told from day one, that as the total caseload increases nationwide, statewide, locally, the deaths follow. So my question for you is, would you tailor your notification to this board weekly in terms of the severity of it? Because obviously death equals a more severe episode of the virus affecting the individual. Will you tailor your future messages to give us that indication? And the reason I ask this is because all along, at least in my mind, and I think in most people's mind, this has been about protecting the most vulnerable. We are a community who love our most vulnerable people very much, and so would the town move to more significant restrictions ahead of the state were we to see that the severity of illness we're seeing in Holliston or the population being affected in Holliston changes in increasing in severity or into the more vulnerable population? So I haven't heard that yet, but that is information that's very meaningful to me, because the next question that would obviously follow is, would we consider restrictions above and beyond what the state did to protect our own most vulnerable here in Holliston?
Sure, great question. So deaths is a trailing indicator, and it follows hospitalizations, which is also a trailing indicator. Right. So when we talk about number of new confirmed cases, that bump comes in advance of additional hospitalizations, additional ICU, additional ventilator use, which is why in Worcester they've already stood up the hospital.
Right.
They already have patients that they've moved over there. So yes, we're absolutely going to continue to look at all of the indicators, and that's why as we're
Okay.
doing the weekly report now, I'm also including the age breakdown.
Yep.
And so for 5 weeks, we had no new cases among the 90-year-olds,
Right.
90-plus-year-olds, which was wonderful. And for the first time last week, in over a month, we saw an increase in cases in the 90-plus population. You know, that's obviously of some concern.
Right.
I mean, and it looks really, really large when it shows a 33% increase, but when our N is very, very small, a 33% increase could be 2 additional cases. So if we went from 6 to 8, it looks, percentage-wise, it looks big, but our total number of additional cases over 90. So this is the challenge with how to properly communicate statistics, is so that they're meaningful and actionable. So yes, we absolutely will continue to watch where are the trends, and that's why as we work with the schools and we look at what's the 0 to 9 increase and what's the 10 to 19 increase, because that's the school age population. And we're paying very close attention to what is the level of transmission taking place in that age group, and what can we as a community and what can they as a school do to get that messaging and to reinforce to the parents and to the students, because again, they're not under the supervision 100% of time of adults.
Well, and I think that's the experience that I'm alluding to, is as a parent of a school-age child, I'm getting the information from the schools to say that there is no evidence of school-based transmission. What I'm missing as a resident of Holliston is the transmission happening around among our most vulnerable in elderly living facilities, in group homes, in that population. There's no place to go to get that.
Sure.
But you've been reporting to us the numbers, and so my only
Right.
ask is moving forward that you will anyway, but I'm just putting it out there that I think that is, for me, is the driving concern, is how are our most vulnerable populations being affected.
And we've been very responsive along the way when we saw a spike in cases at the long-term care facility. That was, the state epidemiologist was involved, the Department of Public Health. There was testing going on both among the staff as well as the entire resident population. When one of our elderly housing complexes had 3 cases out of 72 units, 3 cases resulted in bringing in a mobile testing unit to check everybody. So we have the ability to pivot quickly and to respond to early indicators. I don't want it to get to the point where it's 25 cases at the elderly housing complex, and that's when we decide to talk about doing additional testing. So 3 was a very low bar, but it came together very quickly. We talked about it on a Tuesday and Wednesday, and by Friday of that week, the mobile testing was present. So we've got the ability to pivot quickly.
Yeah, okay. And I'm not hearing you say that's the issue right now.
No.
Yeah, okay, thank you.
No, because again, of the 37 addresses, 26 of them are at single-family homes with just 1 case. And then there are an additional 5 at single-family homes. So that's 31 of the 37 are single-family homes, because it is the informal gatherings where the disease transmission is taking place.
Okay, thank you.
Chief, just to hitch on a little bit to what Tina was saying, what you're communicating is that the transmission is not being realized in any public buildings at this point.
We have no evidence to support public building transmission. That's correct.
So a few minutes ago, you indicated that the governor's under a lot of pressure to reconsider the opening status of how the Commonwealth is doing its business. Back in the spring, there was a period of time when public buildings were closed, primarily to let the facilities ramp up and prepare for public interactions in this new world. We don't envision at this point the public facilities being impacted by any of those future changes by the governor, correct?
There has been no chatter about additional modifications to municipal buildings. There's always talk of certain sectors, such as like restaurants
Salons, gyms.
And, recreation facilities is still always in play because they've seen some clusters. And I know there was some recent research that suggested that there have been some clusters associated with some houses of worship. But there has been no consistent push for changes in any of those sectors.
Right. Almost a month ago, Ms. Hine asked about the status of a vaccine. It had not yet been approved for distribution. I think things have changed in the last month. As we read news reports, we're all wondering, what does it mean for us? In your calls with both state, federal, local, for both state and federal officials, what can you tell us about the likely impact of vaccines as they begin to arrive, and what impact would that have in Holliston?
So I was just on a call with the White House this afternoon at 5 o'clock for a briefing on Operation Warp Speed and the summit that's taking place at the White House tomorrow. There is expected to be probably 300 doses of the vaccine in the Commonwealth.
300,000, I think.
By the end of the month.
You said 300?
300,000.
Okay, thank you.
Yep,
Yeah.
300,000. The governor announced during his remarks today that he has already put in his first order to the federal government as part of the distribution plan. Each of the states needed to submit to the federal government their plan for distribution and who their priority recipients would be in the first round, because obviously it's limited. And they will be targeting first-line healthcare workers, and after that, elderly housing complexes or long-term care facilities.
This is Massachusetts.
That's their plan, which none of the state plans have been approved, but in terms of the overarching guidance which has been mentioned, the priority is going to be healthcare workers and then long-term care facilities, because they don't want a Holyoke Soldier Center type situation to happen again. Some of the complicating factors are that with all of the vaccines that are being brought to market that are seeking emergency use authorization from the FDA, they're all 2-dose regimen. So it's not just set it and forget it. You don't get the dose once and then you're done.
Right.
You get the dose, you're going to get a card that reminds you you're going to have to come back in and get another dose within this specific window of opportunity for this to be as efficacious as possible. The good thing is the way the Operation Warp Speed was designed, which was a partnership between the federal government, the military, and private industry, is that as these vaccines are being brought to market, they've got a very comprehensive distribution channel that's set up, which includes FedEx, which includes military. The challenge is some of these vaccines can't just be brought to a local facility and put on the shelf and then, handed out to local boards of health. Some of them require storage at very, very low temperatures, which not everybody has the equipment for. So early on, your smaller local regional health centers probably won't have the vaccine availability right away because it could spoil if they didn't have the right equipment to be able to store. But they're working with some of the big chains. And I even saw today that a pharmacy, which has a facility here in town, is looking for skilled workers to be able to be part of their administration rollout, because they're anticipating they're going to have a supply and they're going to need people who are going to be able to administer it and not take away from other things that they're doing in the pharmacy at the same time.
Too often we put you in a position of being a person that wears many, many hats, but you've been great to take on questions sometimes outside your lane. This one is, I know, outside your lane, but let me ask it anyways. Do you happen to know from what you're hearing if the vaccine is a one and done after you get through the first 2 regimens, if you are now for the rest of your life, like any other vaccine, potentially inoculated against that? Or is it seasonal, like a flu, and you need to get another shot next year for this and so forth?
It's too early for them to be able to say with any confidence, because this that's why it was called a novel coronavirus when it first came out. They don't know enough yet. And whether or not this is going to be something like tetanus, where you may need a booster in 10 years, they are hopeful that there is not so significant a mutation that you would need to do it annually the same way you do with the regular influenza vaccine.
And-
So the answer would be somewhere between the two, probably.
Sure. But they just don't know that yet.
It's still too early.
And currently, it's envisioned that the vaccine, when it arrives, for both first responders and ultimately to the general population, it would be free. Is that correct?
That is correct. As part of the agreement that the government had with Big Pharma was that it would not be, there would be no cost to the end recipient. It may be billed to the insurance companies, but the cost should not be an encumbrance. That should not be the reason that someone opts not to get the vaccine because they don't want to pay their out-of-pocket for a visit or for.
Does the warp speed strategy, with what you hear, do they give you milestones? Do they say, in 3 months we hope to achieve this, in 6 months we hope to achieve this? And if they are, can you give us an idea of what to expect over the next 6 to 12 months, if there is any such window of both vaccination and control of the virus?
So it's an excellent question. They continue to ramp up production and distribution of the vaccine over the next 6 to 9 months. However, they have indicated that even if we have high participation rate by the population of the vaccine, because there are some people who are hesitant to participate in vaccination programs to begin with, even prior to this being brought to market, they're still saying that by next fall, that a lot of these mitigation measures, which Mr. Sparrow was talking earlier about, hand washing, physical distancing, wearing face coverings, avoiding large groups, could still be a reality for much of our society even next fall.
What percentage of the population do they expect to be vaccinated within the next 6 to 12 months? Do they give you an idea?
I would say that they're hoping for 50 to 70%.
Okay. Any other questions?
Yeah, I have two real quick ones. I'm
good?
sorry. Do
Just one.
Oh, I'm sorry.
Okay, we'll get back to Ben. Go ahead. Go ahead,
Oh,
Tina.
okay. First responders, teachers on the list for Massachusetts following long-term care residents and facilities. Like, how, does it go that far? Or just stops there?
So, first responders and teachers, because the plan has been submitted to the federal government but not approved and therefore not released yet, there's been a lot of talk about where those specific groups lie.
Okay.
As to whether or not they're Tier 1C or whether they're 2A.
Okay, so the answer is not sure yet.
Right.
Okay.
We don't have, and then you've got some people who are dual status, which
Right.
makes it even more complicated.
And then, do you envision in Holliston's future a vaccine clinic run through the Board of Health?
No,
Okay. All right.
they do not have the capacity to manage that.
Thank you.
It would be much safer and more efficient for that to be any local to be done through the big box
Okay.
pharmacy store.
Thank you.
Does the Red Cross have a role in that, or would it?
No, they really don't have the bandwidth to be able to provide that either.
Ben, I think you said you had a follow-up.
Yeah, just quickly, did the numbers that we have, does that include, do we know who hospitalizations?
No, we do not
Okay.
have hospitalization data.
Okay, because to piggyback on what Tina was saying, I think that would be a metric that I think would be impactful in understanding the scope.
Sure. One of the things that I'm watching, because we happen to operate the ambulance in town, is the number of patients transported either with COVID-like symptoms or people who indicate that they have already tested positive.
Gotcha.
And that, again, is just another one of those touchstones that we look at in the full compendium of all of the data we have available
Gotcha.
to identify what is the current situation today.
Right.
Because, again, not only does that impact our run rate for use of PPE, but also for what the experience is in the community. Because, if you recall, when I first came to the board back in March, even though you were on the other committee at the time, we talked about the percentages of, the number of people that would get the diagnosis and how many of them would be able to recover at home without any interventions, how many of them would need pharmacological intervention, and then the smaller number that would need hospitalization, and then
Right.
even the smaller number that would need ICU support. So again, there are a lot of subgroups. You know, just because somebody gets a diagnosis doesn't automatically mean that for them it's necessarily going to result in a hospitalization, ventilator, or unfortunately, ultimately, a death.
Right.
So
Okay.
we're watching. We're keeping track of everything. There's so many numbers coming across my desk on a daily basis. I've got spreadsheets and pivot charts and lots of things that I'm keeping track of.
Understood. Thank you.
Sure.
You all set? Chief, thanks for the coronavirus community update. Let me ask any members of our Zoom call, such as it is, if there are any questions. There's a handful on the call, so hearing none, we'll move on to the CARES Act programmatic update portion of your delivery.
Great. So first of all, I did participate in a conference call last week with representatives of both MEMA and FEMA, and we were talking about the reimbursement process, and there have been some changes to the PA program, and some of the items which we thought were going to be FEMA eligible, which we had been tracking on our spreadsheet as FEMA eligible, some of the things that the schools had been tracking as FEMA eligible. Last week, we were told, yeah, probably not going to get reimbursement for that, which we all along knew was a possibility. There were some people on the call which were very vocal and very upset about the fact that it would have been nice to have known that these rules would be changing sooner. But what's going to happen now that we're through special town meeting is that I've got to review over 650 entries in Munis. And on my spreadsheet where I've been tracking yes, no, FEMA, I'm going to have to reanalyze every single one of them based on the new rules of engagement that I heard from MEMA and FEMA last week. And so my expectation is that within the next 2 weeks, I will be able to give you a more complete picture, because my expectation is that coming into your December 21st meeting, I will be making recommendations to you in terms of votes that I would ask that you would take so that we can make sure, and whether it's a journal entry or whether it's some other administrative mechanism to make sure that come December 30th at midnight, that every single penny that we need to obligate to CARES can be obligated to CARES, and anything that we have good certainty will be FEMA eligible is not included in that CARES obligation. But I do have 2 requests for you this evening that I would ask that
Before you get to that, so
Yes.
looking at the spreadsheet, are you suggesting that the 144,321 is going to get scrubbed?
It will be a smaller number.
Reduced.
Correct.
It's going to go down?
Yes.
But that's not the revised number, clearly.
What my spreadsheet through today was under the old paradigm, because again, I need to go through line by line and
And,
analyze.
well, that goes up, will the CARES Act number go up? Is that how? it will
CARES Act number will go up, yes.
Okay. Did you have a clarifying?
Yeah, I just had to clarify because my question's about FEMA. So the 144, I mean, obviously we're going to scrub that, but have we received any of that money?
No, we haven't applied for any reimbursement.
From FEMA?
Yet, no.
Okay.
We're tracking all of the expenses, and we're like many other municipalities who are,
Yeah.
trying to, it's a big game of 3D chess.
Right.
We're,
Is there any risk here? Like, is there any risk of as we go forward and we go through the CARES money, if there's some money for FEMA and we apply for it and they say no, is there any risk to the town?
The risk is ensuring that what I bring to you in the next 2 weeks is as conservative as possible,
Okay.
based on the new restrictions that FEMA voiced last week. I'll give you an example, and I
Yeah.
know it's one that we've been discussing here. The folks from FEMA said, we've been seeing a lot of those signboards being put in for reimbursement. They said, yeah, we're going back to those towns and asking them, why didn't you just rent? Did you really need to buy? Because they may not get the reimbursement for those signboards.
Gotcha.
So that's the sort of thing where, that was a specific example, but there are other rules, things like cleaning and sanitizing of public buildings is what was on the guidance from Treasury. It's what was on the guidance from A&F. But now FEMA is saying cleaning and sanitizing public buildings is FEMA eligible if it's first responder or directly related to a positive case.
A deep clean.
So police cleaning,
Yeah.
75% eligible. Fire department cleaning, 75% eligible. Library, 100% CARES Act.
Yeah.
Got it.
So everything that we've been assuming, that we were calling cleaning and sanitizing public buildings, where we were saying 25-75 split, now we have to go back. Now, when we have a case here at the town hall where we think that there may have been exposure, and we bring in our cleaning company to do a deep clean, that's tied to a specific case.
Right.
That one is 75% eligible. Just that, not the entire month's bill.
Got it.
Yeah, so it's maddening.
It's going to be fun.
I just want to point out one thing there too, because I don't know that we've discussed it here, but for the deep cleaning, which is responding to not necessarily a positive case, but a case where we, are concerned, so we want to do a deep clean. And that's the one that is still covered, right? Looking to the second half of the year, which obviously we'll be doing between now and when we close this out. Some of the equipment that's been purchased through the CARES Act is going to help us to be prepared to do those deep cleans ourselves. So the electrostatic cleaner that's now been operated, I know you've used one, and I saw the building facilities manager using one with his N95 mask and getting equipped with, we'll be prepared to do some of those things in a sort of different method in the second half of the year. But I just want to point that out.
Right, so we've been building capacity to allow us to be more self-sufficient, because although FEMA eligibility would still be there as of December 31st, we, the town, would be responsible for the 25%, because there would no longer be CARES funds. So, for example, when the police department have a guest, and their policy is that after the guest has been either released on bail or sent to court, they bring in an outside service to do a deep clean. Because that's a public safety agency, that's eligible. The schools, again, had been operating under the cleaning and sanitizing of public buildings, and so they've been charting their expenses, and they were thinking 25% CARES, 75% FEMA. FEMA says, no, unless you did a deep clean in response to a positive case, that school cleaning isn't. However, the one caveat would be, if you did a big clean back at the end of the summer, just before you brought people back in, that would be eligible one-time expense, but not weekly or monthly charges. So again, this is why there were some very outspoken people,
Yeah, it's a little late in the
finance
process to be-
officers and other
Yeah.
people who were on the call who were pulling their hair out going, what?
Yeah.
Excuse
You're
me?
telling us this now?
Right.
And so before we get to the charges, I would just point out this too, because the chief brushed on it, but when we get closer to the 21st, when we'll probably be looking to say, here's how we're going to be closing this out in the event that we don't meet on the 28th. The journal entry, right? People are, I think somebody mentioned, like, so what are you going to do when there's $22.50 left? Are you going to cut a check for 20? That's not how it's going to work, right? There's going to be a certain component here where you're going to vote for any remaining balance within this amount will be used for this purpose, and the end result would be a journal entry, right? It's going to be on accounting, but it will be based on your vote, and it'll be based on what the chief and I will bring as a sort of roadmap at that point. So, what the chief has for you tonight is obviously not the end. We still have a couple weeks to sort of close out all of the issues. People are still emailing as close as today to the chief for, would this be possible before the end of the year? But I just want people to understand that, there is, to a certain extent, we're looking at the eligible costs, and at some point it's going to be, you're probably going to have to take a vote that may not be to the last dollar, but to allow the chief to charge up to a certain amount to wipe the remaining balance so that we go down to zero and don't turn any money back. And then if any sort of thing changes from the FEMA side of it, we're then prepared to sort of deal with that on an accounting specific basis, right? Okay, so I just wanted to clarify that.
Great.
Tina?
You mentioned finance officers on this call. I'm wondering if there are any mothers on this call. Because when I look at the list of what we were charging FEMA for, I look at PPE and cleaning and sanitation, and I'm thinking, you've got to be kidding me, that the use of PPE and cleaning and sanitation that results in no positive cases then becomes a reason to not have that reimbursed by FEMA because you didn't have any positive cases. That we would have gotten more FEMA reimbursement if we'd waited on the PPE usage and the deep cleaning and sanitization until we had a positive case. That's what would have triggered, that will be the thing that triggers FEMA reimbursement.
So here's another thing when you talk about PPE. So PPE for first responders is going to be 75% eligible.
Right.
The FEMA does not consider teachers to be first responders. So any PPE purchased prior to September 15th would not be after September 15th would not be FEMA eligible. So, and again, they have rules about stockpiling, and yes, so.
I hear the frustration, and I can appreciate it.
Were there mothers on the call? I'm sure there were, but they held their tongue and they were very demure.
Okay.
Mike, just a couple of questions. Holliston was provided $1.317 million in the
Yes.
CARES Act.
Yes.
According to the latest tracking sheet, we have approximately $302,000 unspent.
Correct.
I've spoken to the town administrator, and I believe we're going to see about half of that go against our ledger. Is this the time you want to bring this up, or do you want to bring it up later?
The against the ledger will be on the 21st, but I do have two requests for you tonight.
In addition to that?
Right.
Okay. So we're whittling down, we're getting down to the brass tacks of this $300,000 balance. As I look at the schools, we've spent approximately we've obligated about $240,000 or so. Early on, when we met with the superintendent and the business manager, the thinking was if they found themselves over-obligated through their CARES funding, we might be able to help them if there were costs that were eligible under our award. Has that reconciliation happened? Is it planned to happen?
It plans to happen. And as we've been doing quarterly reporting, there have been conversations between the business manager and myself, and we've had discussions about, do you want to claim this expense or will I? So those, on an interim basis, have been occurring, but in terms of the final reconciliation, to make sure that, because at the end of the day, our 1.3 million on the municipal side is only part of a larger $2 million appropriation that came to Holliston, because we had the $225 per pupil that was
Slice,
administered
yeah.
through DESI, plus you had the $54,000 in ESSER funds, which were all CARES.
Yep.
So all total, there was about $2 million in play for the town.
Yep.
It just different agencies and organizations had charge over different sets of it. So yeah, I'm in contact with Keith, and when I was on that call with FEMA the other day, I reached out to him in real time and let him know that the rules were changing. And from the beginning, we always knew that this was a possibility. And so, again, the business manager has been doing this a long time. He is very agile and is able to adapt. And I have every confidence that what we bring to you with our final makeup and confirmatory votes and not to exceed kind of votes on the 21st will ensure that everything that we can charge legally to CARES will be charged, and anything that we can hold off to the side that will be considered to be a slam dunk for FEMA reimbursement will be held there, and that we won't do anything that would open us up to any sort of scrutiny from federal or state regulators.
Did you want to talk about the requests for this evening, Mike?
I do have two requests for you. The first one comes to us from the treasurer, and this is in the amount of $147,583.46, and that is in unemployment insurance costs. So these would be a reclassification, and those cover the period from March of 2020 to October of 2020. So 147,583.46.
So in effect, when and if we approve this request, there could very well be additional charges coming, to your point, before the end of the year, from October 21st through December 31st.
Yeah, so we'll have to make a decision based on, once Chief Cassidy goes back, does the munis scrub he was talking about earlier with the FEMA
Yep.
charges, if it makes sense at the point when we get towards December 21st, when we come back again, if we want to, if the board wants to estimate November and December based on the trend of what we've been being billed on a monthly basis, we can certainly look to authorize a use of funds up to that, because we would not have an unemployment bill for the month of December until January. So we would have to do some estimating. November we would have before the closeout of December, so we could have you vote up to an amount.
Are there any questions on this request?
There are not.
Good. I'll entertain a motion to transfer that amount. Mr. Clerk, if you could read it.
Yeah, I'll make a motion to transfer $147,583.46 from CARES Act funding to the unemployment line.
Yes.
I'll second that.
All those in favor say aye.
Aye.
Great, thank you. And again, that was a new use that was allowed under round 2 of the CARES Act funding as administered through A&F. The second one, much smaller number. Always start big, then the next
Sure.
one seems much more palatable. In the amount of $3,983 for HVAC and air filtration at the fire department. So this would come under cleaning and disinfecting of public buildings because we're a first responder agency. So we've got some specialty filtration equipment in our building, and the filters are extremely expensive. There are four-stage filters, and then there are 2-stage pre-filters. And to be able to make sure that the operating environment for our personnel are completely clean and have the brand-new filters that are appropriate, it's $3,983.
Do you have that number?
I do.
Would you like to make the motion for that item?
Sure, I will make a motion to transfer $3,983 from CARES Act funding to the fire department for filtration and cleaning of the HVAC system at the fire department.
Do you have a second?
Second with a question, the filtration system is running more frequently because of the pandemic?
It's running anytime people are in the building, so yes. And although we had a lull early in the spring, we've been very busy lately.
Okay, I second it.
All those in favor say aye.
Aye.
That carries.
And that's it for my request tonight, but I would also note the Board of Health received notification on Friday of $3,000 in additional funding that they have received from the Massachusetts Health Officers Association, which must also be spent by December 30th because it's CARES funding. They are one of 49 communities in Public Health Region 4AB, and the region was distributing $75,000 for us to get 3,000 of the 75 out of 49 communities. That's a good amount. And then again, the town administrator did remind department heads last week to get any additional requests in ASAP and to make sure that any boards or committees make the appropriate votes in accordance with your flow chart and process. And I do believe that we will see at least one other vote being taken by another organization in town tonight that I'll be bringing to you in future weeks.
Sounds good.
Great, so that's it. Hopefully I got you as closer to the 7:30 tax classification hearing.
Thanks again, Mike.
Absolutely.
Outstanding.
Thank you.
Thanks,
We'll move
Steve.
on to our next item, warrants. Mr. Sparrow, if you'd be so kind as to
Sure.
read
I
the
will
warrant.
make a motion to approve the warrant in the amount of $1,672,208.37. Of that, $1,299,919.41 is town payroll.
I have a motion. Do I have a second?
Second?
All those in favor say aye.
Aye.
That carries. Public comment, Mr. Sparrow.
I think my only comment will be just again expressing my gratitude to everybody who came to town meeting and all the people that worked very hard to make it happen, particularly the town administrator, Travis Ahern, who put in a lot of effort to make this work. So I wanted to say thank you very much to Travis, and I also wanted to say thank you very much to Liz Greendale, the town clerk, and her team, Bonnie and Diane, and the hard work that they put in to make this happen. They've had a busy year, and hopefully they get a break. So I just wanted to say thanks again to everyone who came and to those people who put in an enormous amount of effort to make it run as smoothly as it did. It only was an hour of screen time, but there was many, many hours behind the scenes that made that happen. So thanks again. So that's my only public comment.
Tina?
I agree with Ben 100%, and I just wanted to add that next week, the Safe Routes to School Task Force will have its first kickoff meeting. I will be joined by our Safe Routes to School coordinator, as well as Lieutenant Larini and Vice Principal Jessica Beatty from the Adams Middle School. So this will be a first task force meeting, and it was the next step in advancing Safe Routes to School here in Holliston, so I'm excited for it.
Thanks, Tina. The only item I'd like to remark on relates to the fact that Chief Cassidy was talking a few minutes ago about the future of our community and the impact that the vaccine will have on hopefully bringing us all back to some condition of normal. We have to envision better days ahead. And to that end, Holliston turned 296 years old last week. I haven't been around for many of those years, but some of them, and I do remember the 275th Gala, which was a really, really wonderful time for the community. Looking ahead, I think we're a little premature, but certainly I think within the year, this board should be considering forming a committee to look at recognizing the tricentennial of our community's founding, December 3rd, 1724. Just something to keep on our focus and hope for better days ahead. Let's talk about comments from our town administrator.
Do you want to offer up public?
Are there any comments from the gathering on the Zoom call for public comment? Hearing none. Comments from Mr. Ahern.
All right. So not too much to go through here. A couple things that I'll be bringing forward in the future. I think next week on the agenda, I will be ready to bring forth the question that came up previously from public comment for Blair Square trash pickup. Sort of circled all of the areas of interest there and ready to put that as an agenda item for discussion. We had also looked at potentially having a public hearing for the solar project at Marshall in December. I am looking now at January. It won't push back our timeline, but I'd like all their materials to you and the public to be rounded out. So I think we're looking at a January timeline for that rather than the 14th.
How, real briefly, folks haven't heard too much from us on the solar project, but it's an important one. They provided us a timeline back in August, and last time I looked at it, we were sliding by weeks. Are we still generally in the vicinity of a timeline that was originally envisioned to bring that system online in the summertime? To the best of your knowledge.
To the best of my knowledge, where they are is that everything that can be done by Soul Systems and our side of it is on schedule, and their concern at the moment is the pace at which Eversource is moving with these types of projects.
Yep.
And so I think a lot of what we want to have in the public hearing on this is really to discuss those types of things. At the same point, I don't know. Hopefully by January we'll have more. They'll know definitively where Eversource stands.
Okay.
And so I think they could certainly give the update that we had planned with the public hearing in December. I think January is more beneficial because they'll have more knowledge.
Got it. Okay, great.
And then with that, I would just highlight one other thing that we were looking at for public comment, which was that the board wanted to look at a public hearing date in January related to Front Street. With the vote that you previously took for the one-way of Front Street as a pilot program through April 1st was the vote. And so we can certainly look at scheduling that. I know under board business we'll be looking at your meeting schedule, and so I'll leave it to then, but that's one thing that we'll want to look at with the schedule. And then lastly, I see Bob Malone is on here. One thing that was announced officially is Linda Marshall, the director of the COA, the director of the Senior Center, has announced that she will be retiring. She'll be with us into March, which will be helpful organizationally to get us in the budget process. But beyond that, it is she's ready to retire, and I'm excited. For her, she's obviously she looked at it previously and stuck with us to get us through some tough times, and I appreciate that. And now she's officially retired. So if Bob would like to say anything now, I think we discussed the fact that obviously the COA will be discussing this more publicly in the future. So we just discussed that I would announce that here to you this evening, and I don't see Bob hopping on. Oh, there he goes.
There he is. Hi, Bob.
Ladies and gentlemen, hello. Travis, thank you very much.
Yep.
Linda, in her report that she has advanced to the council for our next regular meeting on the 9th of December, did report her intent to retire on March 31st. She has offered to stay on for some undefined short period of time to help with transition. Travis and I and Linda have been in conversation about moving ahead with advertising it, developing a job, not a job description because we have that, but position announcement. And then Travis and Linda will be using their contacts, media contacts, to advertise this appropriately and begin the process of trying to identify someone that hopefully would be able to do the job that Linda has been doing. And we are profoundly sorry to be losing Linda. She has done a spectacular job. She's been there for a long time, not just as director, but in other positions. She has brought a wealth of experience and knowledge to the position of director and has really moved us forward. And we're going to be sorry to miss her.
Bob, I presume that once the search is underway, that the Council on Aging and the group associated with reviewing the resumes will work with our town administrator to bring about a hire. Travis, under the Acts of 94, Chapter 94, that describes your job, there are certain positions that you get to directly appoint, and I think this is one of them, if I'm not mistaken.
It is,
Similar
yep.
to
It's
the
listed
building
in the Acts of
inspector.
1994, and Mr. Malone and I discussed this sort of process, how screening should work, and then the end result of probably choosing between the most qualified applicants, and so we're discussing that process, but I'll certainly be involved.
I think what I'd like to do is replicate what you did with the building inspector, another hire that falls under your authority, that I think it would be helpful to bring forth the selected candidate for a meet and greet with our board, not certainly as an interview, but more as an introduction to the community as a selected candidate recommended by you through Mr. Malone, if that's okay with you.
Absolutely. I think we definitely want to make sure any candidate is presented to the community.
Yeah, again, it's not for our approval.
No,
That's
I
your
understand.
call. Bob, I hope all is well. Please pass along our best wishes to Linda, and we look forward to working with you to ensure your transition goes smoothly.
I will do that. I thank you very much. And Travis has been on top of this from the moment Linda expressed her interest in retiring. So we look forward to working with him and with you to get somebody in the position.
Thanks, Bob.
That's all I have.
Yep, we have a couple of minutes before we're due to start our classification or resume our classification hearing as it is. I'd like to knock out some administrative items under board business. Mr. Sparrow, if you'd be so kind to help expedite that. We will,
All right, let's see, do we want to do the meeting schedule?
yep, go right through each one. Yep. Oh, the meeting
The
schedule.
meeting
Let's
schedule
hold
might
that.
be-
Hold.
That might be a little bit more,
Yep.
longer conversation. All right, so the first thing I'll bring up, I'll make a motion to receive a gift from the Holliston Reporter to the fire department in the amount of $250. And I'll make that motion to accept this gift. It's an unrestricted gift to the fire department,
Into their gift account, right?
into their gift
I have a
account.
motion of a second.
I second that.
All those in favor say aye.
Aye.
That carries. Next.
The next one is the town clerk. So I'm going to make a motion to receive a grant from the Center for Technology and Civic Life for COVID-related expenses in the amount of $5,022.50 for the town clerk.
I have a motion to have a second on that.
Second that with a real quick question for you, Travis. Do you know, is this the first time the town clerk's been awarded a grant from this center? I read it over a little bit. It's quite impressive. This is a nationwide center that I think there were 2,500 election offices that could apply, and we were awarded $5,000. I'm just amazed. So
I'm not sure if the town has ever got anything from this group before, but I could certainly have Liz Greendale update you
no,
on.
I just wanted to
Well, it is,
acknowledge
you're right.
that.
I mean, yeah,
it's a
no,
pretty impressive grant to
it's
receive.
great for her to have done this.
Yeah, so I second that.
All those in favor say aye.
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 That carries. And the last
The
item.
last item, I'll make a motion for to approve the select board meeting minutes for November 23rd, 2020.
I have a motion of a
I'll
second.
second that.
All those in favor say aye.
Aye.
That carries. All right, so we're going to come back to our schedule and other business, but at this point, Travis, let's resume our continue our tax classification hearing. I see the town assessor, Kathy Pierce, is joining us on the call. Kathy, I don't see anybody from your board with us, so I guess you're going to be carrying the water at this point, correct?
Well, it's a matter of carrying the water or dropping the glass and having it spill all over the
Right,
place.
I understand. So there are some developments associated with the continuation. Do you want to bring us up to speed, Travis, on what the board should be considering this evening?
Sure. So Kathy did get at 4:30 today. The values were certified by DLS. We're still waiting on another certification to finalize. And at this point, there's quite a bit of information the assessors could share with you, but we would have to get back together tomorrow night. So at this point, I think it would be best if we just do all of it at tomorrow night, starting at 6:30, where we're both posted, the assessors and the select board.
Are the Board of Assessors posted for 6:30?
6:30, yes.
Okay. And one of the things we're not certain of is if that, in fact, would be approved for tomorrow night. It'll be a day-to-day thing, right? We're posted tomorrow night, we're posted Wednesday night.
We're posted for tomorrow night at 6:30 and Wednesday night at 6:30.
So
Right
if
now,
the new growth doesn't surface, we won't be meeting until it does, correct?
That's correct. Would that be your intent, Kathy? We would continue until...
That's my understanding. I mean, the problem is the excess levy capacity. We could estimate it, but then the Board of Selectmen would meet on their own to sign it, and that doesn't seem, there should be questions. It would be better if we were all together at that point to address any questions.
Yeah, I understand we have a few work days to play with before we run into any extremists with tax bills, so let's play it day by day. And if you tell us that the new growth number is ready to go, we'll convene tomorrow night and knock this out.
Okay.
Or the night that it becomes available to us, or the next couple of nights.
Okay. So for now, we would be continuing the public hearing that has
Right.
still been open. Yep.
Just want to, for the record, I want to, when I was on the Board of Assessors for 15 years, this kind of thing never happened. So I don't know what's going on over there. Maybe people need to get paid more. I don't know.
Just joking,
I meant
Kathy.
stipends, by the way. So there, pass that along, Kathy. So at this point, we're going to continue our hearing until a time certain when Mr. Ahern notifies us that you guys have new growth in your hands, and we'll catch you then.
All right, thank you.
Have a great night, Kath.
Thank you, Kathy.
Hi, Kathy.
Yeah.
All right. Let's circle back to our board business. I believe we were beginning to talk, Ben, about the select board meeting schedule between January 21 and June of 21.
Ooh, okay.
Big
Yes.
chunk of time there, but I'm guessing the town administrator wants us to talk broadly about schedules.
Yeah, so if there's any of these dates that are problematic, that would be good to identify now. Also, as I said, there's a few things that we're going to look ahead to. So right now, my thought, and again, these don't need to be set in stone at the moment, but you wanted to come back and have a public forum of some kind on Front Street before you're ready to make a decision in the long run. And then also, I will be looking to schedule the public hearing for the solar group, which would be Beth Greenblatt, our consultant, and then also Sol Systems, the group doing the work. And so if there was a time that worked better for the group, you could let me know now, and I'll make that work.
I'd personally like to see the Sol Systems folks within the first 2 weeks of January.
Okay.
We
I
also,
thought January 11th may make sense.
Mm-hmm.
Okay.
we also have a water rate hearing that needs to get on the calendar.
Water rate hearing, yep. I can bring that. I can talk to Sean and come back to you on that.
When you do, could you make a request on my behalf? We had a water rate study done a
Fine.
year ago. Well, no, in this year. I'm looking for, I may have it in my inbox, in which case I cannot locate it. So if he could forward it to me again
Yes.
in prep for that hearing, I'd like to be able to take a look at it, as I'm sure Ben and John would appreciate as well. That would be nice prep ahead of the water rate hearing.
It also occurs to me that in January, we have to provide an evaluation for the town administrator.
Yes.
That's going to be a very difficult time for everybody.
I know.
So we should plan ahead.
You'd
what
want
I
to take
mean?
a day off after that, for sure.
Yeah, easily. Yeah. Dark day.
I will be sending out performance evaluation information to all department heads, and I'll be sending out all the forms that we can go through as well.
Have we had any discussions about or thoughts about like a budgetary process and how that would fit into the scheduling?
we can certainly do that. At this point, my intention is to get all performance evaluations done of, I'm not focusing on myself at the moment, but I can certainly put that in the equation. I would like to get all performance evaluations of department heads, whether they're done by me one-on-one, or if they're done by a boarding committee with then me coming in and reviewing the process at the end by the middle of January, which I think will put it in good position in the budget process.
Does this include budget guidelines?
So budget guidelines have not discussed. I think at this point, Monday night, I'll probably be also discussing with you where we stand looking forward, and then I'll be discussing, the intent right now would be that I would be discussing with the Finance Committee on the following Tuesday any information that this group has for looking ahead at assumptions for FY22. I don't know when guidelines will be going out specifically. Generally speaking, we'd like to get information out to boards, committees, department heads, at least in the early January.
It's usually actually early December.
Yeah, that would be ideal in previous years where we have special town meetings in October. Now that we've just got through one, I think we can still get the assumptions all done relatively soon.
I think there's some benefit to waiting. I mean, not to oversimplify what we're about to look at for FY22, but everything from what I understand hinges on CARES Act Round 2 or Stimulus Round 2, whatever you want to call it. There's been a lot of chatter about what the federal government can do for states that are still reeling and will continue to reel after January 1st when the CARES Act monies expire. We all know the Commonwealth for FY21 balanced its budget a lot with CARES Act money and the use of stabilization money. The governor will be filing his budget in January. I think it's the last Wednesday in January. I would hope that by then the federal government would have clearly signaled what it plans to do. There seems to be some favorable movement now that the federal election is over with to pull something together. And logically speaking, if that does materialize, Travis, I think FY22 seems a little bit more stable. But without that federal relief, I would call FY22 unstable. Would you agree?
Yes.
So waiting until January to learn about those dynamics and those metrics makes perfect sense to me, because establishing any guideline now is just, it's more than guesswork, and it's something likely you'd have to undo or revise.
I think for a number of things, what we can look at for assumptions or local receipts and those types of items that are, weigh heavily on our budget, that we can begin to look at trends as we get towards the end of this calendar year, the first half of the fiscal year. Make sure that we're still on target for what were conservative assumptions for those areas. Look at things like new growth, which we'll discuss when we finalize the tax rate, which is that, surprisingly or unsurprisingly, we would think during a difficult economic time that new growth would be a trouble, and in fact it has not been. It's been, the building department has been booming with permits. So there are a number of assumptions that we should be looking at now. You're right that one of the major ones is going to be based on what the state is doing, and the state is going to be doing, to a certain extent, is going to be based on what the federal government comes out with stimulus.
When we talk and finalize the classification piece, we touched on it last week. A lot of the activity associated with values is pre-COVID, but Kathy did indicate that our local housing market during COVID has been just as robust. So I suspect going into next year, Travis, that status quo is something we can reasonably plan on in terms of values and supporting the ability to raise and appropriate against known values. I just think we're trending in the right direction. I don't think it's going off the cliff. 60-70% of our budget is derived from property taxes, so as long as those numbers stay stable, I think we're in a stable position.
Right, and so I think for this, looking at the schedule here, I certainly intend to bring forward to you next week the beginning of the conversation of looking ahead to 22 now we're through the special town meeting. And I think that people are going to need to begin to look ahead, and some of that will be dependent on what we get, and some of it will be making sure that we're ready to go with a budget in May and not fall behind.
I can't look much beyond January right now, but do you
Well,
folks have any thoughts on the schedule?
So the first thing that you brought up was the Front Street Forum, so let's get that on one of these January dates.
Sure.
I'd go with the 19th, just because it seems reasonable.
Sure.
Yeah.
All right.
Is it the 19th or 18th?
I've got
19th.
Tuesday the 19th.
Martin Luther
Monday
King
being
Day
the
is
holiday.
the 18th.
Got it.
Okay. And then Chief Cassidy, do you want to put down an official, this pandemic ends date? Can we circle one on the calendar?
Not within my authority.
Okay. All right. But in all seriousness,
Call Fauci.
Yeah, we're doing at the White House today. Well, let's just call it May 24th. I don't know. That sounds good.
Oh, that's not a
Think
nice day.
Yeah, we can make
It'll
it
be a nice
then.
day.
Coming back to a conversation we had in our meeting on Saturday before we went into town meeting about changes that potentially could come for the warrant with the way the budget would be presented in terms of categories and so on. So simplifying the budget.
Right.
Does that layer on to how we'll go through February, March, preparing the warrant, approving budgets? Is that a consideration, or we're going to repeat what we did last year, department by department?
You may want to repeat, because I don't think a lot of people were present when we had the conversation.
fair enough.
If you're going to explain.
So we
what-
talked about, with Jay Tallerman, our town council, we talked about a change to the annual town meeting warrant that would simplify the budget presentation. I think we all received feedback from Saturday that the abbreviated warrant, that the quickness of the meeting were things that voters really appreciated. So if we were holding that up as a goal for annual town meeting in May, we could simplify the way the omnibus budget is presented in that article and have more simplified categories. So instead of doing line item by line item for each department, we're doing general government, we're doing public safety, we're doing broader categories. If we were to make that decision, my question is, would that change how we go through approving our budgets late winter, early spring?
I don't think it would
Okay.
at all, because and I think this was part of the conversation with Jay, was the way that it's voted is one view of it that then ends up being at the end of the year, money that needs to be moved in and out of different departments or different lines within the department. At the end of the day, no matter how you vote it, you still want your full comprehensive budget
Okay.
that's available for anybody to see, sort of line by line. The conversation I think that we need to have, and what I would see in another community, is by voting 4 lines within a small department, for example, is unnecessary. I think my first day was town meeting, right? And so by reading each of those 4 lines per department as a minimum, it took 25 to 30 minutes just to read the budget. And what you normally see more is every single line detailed, right? So that there is a comprehensive budget available, but then the reading of the budget or the presentation within the warrant itself is just personal services and operating within a budget is the more common use. And then what Jay was saying is that some towns have gone to it where you just vote public safety altogether. That would be a giant leap rather than a baby step. I think the baby step that we would want to probably go towards is not 4 per department. But even that, I guess to your question on the schedule, it changes nothing in my mind about the schedule because we're still putting the comprehensive budget together. It's just that we would be presenting a separate view within the warrant.
Fair enough.
right.
So I think that one thing that I'll probably be bringing to you about schedule would be making sure that, your, I think one thing that I've heard back from department heads is on your schedule specifically that they may present something to you, you have questions, but then there's not an opportunity for a department head to then come back and present any information if you had follow-up questions. So I think working out that schedule to make sure that you have time to ask questions, and if answers are not readily available, that you have time to sort of get follow-up. That's something that I'll be looking at with this schedule.
And I think from a scheduling perspective, when those dates or those budgets come into focus, I think the board should stand ready to tackle as many as possible at once. And if that means we meet a second time during a week, that'll keep the train moving. I don't want 1 or 2 budgets a week for 6 weeks. We'll never achieve what we're looking to do. I'd rather tackle them, get the questions out, and give ourselves some opportunity to meet a deadline or achieve an outcome of having our budget ready for town meeting, presumably in May. So I'm ready to double down on the meeting schedule if needed, but I'd like to see a bundling of those departments so that we can make use of our time. Okay?
Absolutely. And just so everybody, I'm aware when I look at scheduling, these are going to be on Zoom for the most part. Is that,
Right.
we're comfortable with that?
Yep.
Okay.
Yep. And one thing I do want to point out for anybody listening, this board's had great attendance. I have to say, you folks are great. I don't think anyone's missed a meeting yet this year. So we've had we always have one. Ben,
I had to miss
great
one.
job, Ben.
I missed one executive session.
Outstanding. I mean, the attendance and the cooperation from this board's solid, so I would expect going into the second half of the year that not to change too much, so.
Great.
All right, so is that enough on our schedule to keep you busy for a bit?
Yes, I'll put solar on the 11th, Front Street on the 19th, and I'll get back to you on the water rate setting.
Thank you very much. All right, other business.
Oh,
This-
and just so,
Oh.
if anybody's interested, currently, based on our bylaws, the town meeting would be Monday, May 10th, 2021, 7:30 PM, unless the select board chooses to change that date, given circumstances that we will not
Discuss at this point in time.
pontificate on now.
That's way down the
Seems like
road.
100 years from now. Ben, any business under other business?
I have no other business at this time.
Done.
I do not. So at this point, we are going to adjourn to executive session. Reason number 2, negotiation of non-union personnel. And we will not be returning to this gathering. So I will entertain a motion to adjourn to executive session.
So moved.
Second that?
All those in favor by poll, Mr. Sparrow?
Ben Sparrow, aye.
Tina Hine, aye.
John Cronin, aye. So that is it for this evening, Holliston. Thank you for joining us. We will catch you next week, if not tomorrow or the next day. Watch our agenda. Thank you and have a great night.